What's up, beautiful people? Another day, another study. I actually like this study because it's looking at something where I have an area of interest, and that is in using NR, which is an NAD precursor for long COVID. I've taken care of long COVID patients. I actually suffered from long COVID after I got the first bout when I was still working in the hospital ICUs, taking care of COVID patients. And it was a year of just muscle aches and fatigue and brain fog. My lipid levels went through the roof. So I understand what patients go through when they experience this. Long COVID affects approximately 7% of individuals after they have an acute COVID infection. And the symptoms are very nonspecific, things like fatigue, brain fog, muscle aches. There can be mood changes, more anxiety, more depression. I've seen gut issues where people are now having irritable bowel type symptoms with constipation or diarrhea or just gas and bloating. And the proposed mechanisms for long COVID include immune dysregulation, mitochondrial dysfunction, oxidative stress, disruptions in blood sugar and blood lipid metabolism. And preclinical studies show that COVID infection dysregulates NAD pathways, so it increases NAD consumption and depletion. And there actually have looked at NAD levels in patients suffering from COVID and saw lower NAD levels in patients suffering from COVID. We also know that NAD is released into the blood during periods of acute stress. It's part of the stress response in the body to help with immune system and other things. So this is a 24-week study. They used a placebo roll-in period, and then they had two groups. One group got the NR supplement for 20 weeks. The other group got placebo, then NR. So they got 10 weeks of placebo, then 10 weeks of NR. What they found was that NAD levels did increase by about 2.1 fold at 20 weeks in the NR group, and then at 10 weeks in the placebo to NR group. And there was no between group or within group changes in cognitive scores, fatigue, severity, sleep quality, and symptoms of anxiety and depression. They did a post hoc analysis where they took all participants who completed 10 weeks of NR and grouped them together. And there were within group, so not compared to placebo, but compared to baseline to the end of the 10 weeks, improvements in fatigue, sleep quality, and depressive symptoms. And when they associated those with NAD levels, the increase in NAD levels was associated with improved perceived sleep quality. There were no serious adverse events related to NR. The adverse events profile were similar to other studies. Things that could possibly be related to NR include muscle cramps, nausea, bruising, flushing, rash, and vertigo. Now, anybody who says that this study is proof that NR or NAD treats long COVID, no. This is exploratory findings, not the best study design, small number of patients, it was like 58 patients, extremely high dropout rate. It was over 50% in the NR group. And then as people who like to use the appeal to nature fallacy often talk about funding, any study that was funded by Big Pharma, they just automatically throw out. This study was funded by the company Niagen, who makes a NR supplement. And two of the authors actually have equity and are advisors in Niagen. So take all of that with a grain of salt. I wouldn't just completely throw this out. Because of that within group difference, I think that that's enough for a larger, better study, hopefully looking at this. I have used NAD for patients with long COVID. Some of those patients had a great response, some didn't. It really depends on the particular factors that are going on in that patient group. I know other doctors who have used them for long COVID as well. There's a previous non-placebo controlled study using LDN and NAD. We talked about that study before that did show improvement in some long COVID symptoms. So moral of the story, we still need better research on how to properly treat people with long COVID, but I'm not opposed to using NAD or NR based upon the evidence that is there. I would like better evidence, however.